Good afternoon, everybody. Welcome to the Blount County Cares Committee. We appreciate everybody's attendance, and at this time we will take roll call.
Dave Bennett, he is absent. Robbie Bennett, on his way. Cantrell, absent. Carver.
Here.
Cole.
Here.
French.
Here.
Hill.
Here.
Lynn.
Here.
Stennett.
Here.
Wagner.
Here.
Okay, we have a quorum.
Would you like to do the emergency announcement for us?
Sure, it's like a duet. All right. In the event of an emergency evacuation, an alarm will sound. Everyone should exit the building by way of the nearest stairwell in a safe and effective manner. If the nearest stairwell is blocked by smoke, use the other stairwell. Do not use the elevator. Once you have reached the main floor, follow the exit signs to exit the building and quickly proceed away from the building. Please be mindful of others evacuating and of emergency vehicles.
Thank you, Angelique. At this time, we'd entertain any public input on items on the agenda. Seeing none, we'll advance our agenda to the October minutes. I believe everybody has had the October minutes provided to them. I would entertain a motion to accept the minutes. Second. Any questions? All in favor, please say aye.
Aye.
Thank you very much. At this time, we'll move on to items of business, and we have asked for Charlie Sterling to present to us a bit of a review of the Blount County Community Justice Initiative feasibility study, and at this time I would turn the program over to Charlie.
The report has been on the CJI webpage on the county website since July, I believe. Hopefully y'all have all read it. I'm going to do just a brief review. I'm not going to read it to you. On page 1, you've all got a copy of it there. You'll see the CJI. Does that sound weird to me? You see the CJI objectives there in the middle of the page. That was developed by the Justice System Evaluation and Planning Task Group, one of our 3 task groups, in probably that would have been November of 2017. It, along with the CJI mission statement, are on the web page, and it's a part of this report. On page 2, the team and the process for this, that's very straightforward. I think you all know that the Michael Brady team of consultants has been working with us on this. I think they were hired in the summer of 2017. I came on board then in September of 2017. That's all pretty straightforward. The surveys that are mentioned there, the results of those surveys were used in a series of exercises over two workshops on 2 concurrent days to develop the mission statement and the objectives. So that's there for you. That information, like I say, is pretty straightforward. Page 3, the facility assessment of the jail. As I think you all know, there are very regular jail inspections done. Those reports are public record. The biggest takeaway from page 3 of the report here, the most serious issue with the existing building is that it's housing so many more people than it was designed for, and it has been for a long, long time. Additionally, there are very limited spaces available for programs that can help people that are about to reenter the community to gain some skills and be exposed to topics and programs and assistance that can help reduce the recidivism. And another big takeaway is the size of that site limits future expansion, and I'll get into that more later. On page 4, the bed need projections. I think data was gathered probably over 3 to 5 months. I know the consultants probably wore some of the corrections staff out asking for more information, better explanations, trying to understand. So there was a lot of work went into making these projections. And you see there that the projections go through 2050. We wanted to be sure that we weren't trying to look at a short-term solution, but looking long-term. Some of the things considered were historical data and trends, local, statewide, nationwide, arrests, the jail's average daily population over time, as well as the growth trend in the county's general population. The experts that we were relying on say that jail population growth quite frequently closely parallels general population growth. That's pretty logical. The first column, or the second column after the dates there, the average daily population, that's the first thing that they project, and then the column there for bed needs, they add 20% to accommodate peaking, which I'll talk a little bit about some numbers in just a minute. There's not just a standard number of people that are going to be there day in and day out, and it also accommodates the ability to do proper classification, separation of inmates based on their level of offense. In 2017, you'll see there the average daily population, which was a record we started with, was 524. The projected ADP, or average daily population, for 2018, you see there it's 536, and they used a growth rate of 2.35%, and they used that for 3 years in the table there that you see. The lowest daily count, and I've been getting the daily counts for most of the year. The lowest count was the day after Christmas at 515, if I looked at my notes correctly. The highest for 2018 was 612, and based on the analysis that I did, it looks like we're probably going to be close to 580 for our actual in 2018, where the best projection we had was 536. So that's about 8% above the projection that was made just last year. Scary to wonder if numbers are going to continue to increase, or if we can get a handle on it somehow. The annualized growth rate, if you look at that center column, the annualized growth rate, they used 2.35% per year for 2018, 19, and 20, and then they went to 1.55 down through 2030, and then they dropped to 1.24% per year from that point on. And that shows you that in 2040 they're projecting an average daily population of 806 and bed needs of 967. Being the analytical engineer that I am, I said, what if instead of it being 1.55, it was 2.55 for those years? And then what if instead of 1.24 for the next 10 years, it happened to be 1 point higher, 2.24? We can't predict, we don't know what it's going to be, but if it is higher, that could lead to an ADP in 2040 of, instead of 806, it'd be 982. And then, which is 176 higher, and the bed needs would be 1,179, or 212 beds more than developed in this study. We have no better data than this study, but I'm just saying, what if? And many factors can and will change over time. Bed needs, ADP, are going to be impacted by a lot of different factors. Just since 2012, there have been, I think, somewhere in the neighborhood of 2,000 new jobs in Blount County. That's when the population study that they used in their report, that's their data, was 2012. Since then, there have been a couple thousand new jobs announced, good jobs, that are going to bring more people in. Perhaps that'll reflect in more visitors to our local jail. We don't know. But question that I'll just throw in here right now, and we all need to think about, is can we find ways to reduce bed needs, reduce recidivism, and change the addiction and mental health culture in our county? I believe that we can. I'm touching people regularly that are trying to do some new things and working on addiction prevention and that sort of thing. But that's a question we got to ask ourselves. Moving on to page 5, the bed plan shown, it's based on the 2040 total bed needs, and there's really not. I mean, I'd be happy to go into a lot of detail if we need to, but this will be very much subject to change as we move forward. By the time we get into and through a design phase and into and through a construction phase, we may find that we need more or less bed space in a transition center. Fortunately, the approach we have taken is a very modular approach. It will be a type of design that can easily be pulled back a little bit or expanded a little bit, even in the first phase of it. But that's a breakdown of the total study based on the jail, the transition center, male, female, all of that. And page 6, the program elements of the transition center and the jail renovation and expansion that were exhaustively worked through are all listed right there. That's what the task groups identified as the elements of the transition center and the elements of jail renovation expansion that should be looked at. And there's some more detail on that just a couple pages back. The design strategy, page 7 of the transition center. Early on, and like I say, I hope y'all have read this. If you haven't read it, please do. If you have specific questions, I'm happy to do the best I can to answer them. Again, it's on the website. You can read it there or download it, either one. But early on, we realized that a transition facility wasn't viable on the Justice Center site. Primarily, the biggest factor is the size of the site. It's a very, very limited site. There's not a lot of room to build anything else over there. But then in a transition approach, there needs to be a normalizing environment to enhance the inmates' adjustment to preparing for reentry into the community and that sort of thing. So being at another location makes the most sense. At a transition site, at a transition facility, there will be, within the secure area of the facility, there will be housing. and it's based on 24-bed dorms, be program space and support space. And then outside the secure area, the program is that there would be comparable program space to what's inside the secure area, and necessary support space and probation and recovery court would also be on that campus. On page 8 is a tabulation of the transition center options. You can look down the column to the left and then look option by option at what's included. Option F is the one that ended up being chosen. Includes the 12 new housing units with 288 male and female beds, medical clinic, food service, laundry, intake and work program processing, and so forth. You can see, look at all that. And again, if you have any questions, I'm pretty available. Page 9 is the design strategy for the jail. We projected that the did I skip something? Nope. Okay. We projected that the maximum build-out on the current jail site would be 798 beds, most that could ever be on that site. If we built up to that 798 without a transition center, the bed need projections in the table earlier would be met within a few years of moving in. My understanding is that's kind of what happened with our current jail. Projections were made, we built it, we filled it up way sooner than anybody anticipated. Building out that site would also require adding about a 300 to 350 vehicle parking garage. That was estimated to cost in the neighborhood of $7 million. Doing jail expansion and a parking garage construction would require remote parking for pretty much all Justice Center workers, other than the Sheriff's Department on the backside, but everybody else that works in the Justice Center would have to park at some remote site that we would have to find and lease and run a shuttle back and forth, multiple shuttles back and forth. I can imagine the outcry from grandmother wanting to come and sit in on grandson's hearing would be loud and long. And doing the construction would require that we'd have a remote site to store all the construction materials, and we'd have to ferry them in. Tremendous logistics issues, not to mention the cost, if it could even be figured out and worked out. Very, very problematic site. Page 10 is a tabulation of the jail options, and whether or not the jail is expanded on the Justice Center site, the current facility is in need of numerous renovations and updates. How to accomplish them amidst the ongoing operations and the overcrowding is problematic. Where do you put people while you work on any part of the space? And I suspect you will be seeing those issues on upcoming agendas. But that again is the same tabulation. You can see what each option included. Page 11 concludes the report. Again, I'm not going to try to read it to you. Basically, we developed and evaluated options to better address criminal behavior and its many underlying causes. The task group members spent almost 600 man-hours of time working through all this process. That doesn't include the consultant's time. That doesn't include my time. It was a lot of work, some good, healthy debates, but we feel like we determined where we were and what we needed to do. Um, do take time to read through the whole conclusion at your leisure. And then page 12 kind of presents part of the predicament. There's estimates here of the time to complete it. The secure part of the transition center would take about 28 months. The non-secure would take about 19 months. So if we started today, which we can't, but if just for a frame of reference, if we started today, we could potentially move in and occupy the portion outside the secure area in August of 2020. And the secure area would potentially be ready May of 2021. I don't think we can just say there will be no more increase in ADP or no more difficulty for our corrections staff and our Sheriff's Department administration. It's going to be a tough row up until we can do something. But for every month we don't do anything, you can push that August 2020 and that May 2021 back a month. Every month we don't do anything is another month before we can have space we need to help people find their way back into society. That pretty much concludes my summary. I'm sorry to take that long, but I felt like I need to touch on some things.
Thank you, Charlie. In light of his presentation, I'm curious if any of the committee members have any additional questions that they're interested in asking Mr. Sterling.
Charlie, on page 8, in option F, and we're talking about 12 new housing units. Is this being designed so we can have additional units later?
Yes, the design is. I use the term modular, but not like a modular home or something. But it's the pods are identical. The male pods, the female pods are identical, with the exception of a little bit of the plumbing. But we could, if we get into this process and some wonderful and magical thing happens and we don't need that many beds, we can easily scale back in 24 bed numbers. We can also easily add to it. The type of construction, the all perimeter construction has to be secure, but once we're building our partitions and things inside, basically it's sheetrock on metal studs, very, very quick and simple, relatively a whole lot less expensive than hard cells, but yes, it could be easily expanded and added to.
With the sheriff's people and the judges here, the reason I'm asking about that expansion or continuing down the road is, and I'm ignorant of these issues, but for instance, I know that on the weekends, we put DUI people in our jails. We put people in jail who we know are not hardened. We know that they're not going to hurt anyone. And I understand that there's laws and things that forces us to do things that maybe we don't want to do, but hopefully that some of that may be changing in the future. Nonviolent prisoners, could they be housed in a unit like this? That may go to, and can we identify nonviolent people that we could put there versus in our existing unit? Thank you.
All right. Yes, sir. One of the things that Mr. Sterling talked about was classification. Unfortunately, with the population that we have now, there's no real good way to classify people because we don't have the space to be able to separate those folks. So, yes, sir, to your question, those folks could be classified to another facility with less security per se in an environment like this. I can't give you the number right off the top of my head, but it's a great number every weekend that we have coming in on the weekend serving 48 hours. But I can get that for you. But
The number's not important to me as much as the option that we start thinking about. If we're going to spend this money, let's make sure we utilize every bed, and that hopefully we can get our Justice Center back down to 350. You know, maybe by using some of this, or get closer to 350. We may not ever get to 350, but this is a great opportunity to. I'm sure we have folks up there that someone can classify and put them someplace else. Judge, thank you, ma'am.
To address a part of that question, and our treatment professionals can probably help with this part, some of the constraints of our current facility is that we don't have the room to do proper assessments. So there are a lot of great assessment tools that assess risk, assess harm, all of those issues, but we have constraints in our current facility to have people come in and administer those assessments to get the proper data on the inmates that we have on our population. And then if we did have the room to administer that, we have no place to separate. And so that's an ongoing issue. So I just wanted to say that we don't have the space sometimes to be able to discern who's violent, who's not, who needs treatment, who needs a mental health assessment, who needs further appointments or things like that. So that's one of the issues that I think, as far as classification, we don't know. There could be a large number of people that could be pulled out with the proper tools.
I have a question. So the building of the, okay. Question. So if we're going to put, our possibility of putting nonviolent individuals there, would there be separate type rooms? Like if you're looking at plaster, would there be some rooms that may be more secure, like with cinder blocks or something like that, so that if you did have a specific individual, would it be more secure for that individual?
I guess I'll pull out the universal answer. It depends. No, I mean, that I don't want to be too silly because this is very serious. Once we get earnestly into the next phases of this project, we're talking about a couple of years, 2.5 years, to get the facility completely done. One of the first things we'll be doing is working on the schematic design, the more specific design of the facility. And I wish all of y'all could know how amazing the task groups have been that I've worked with. We get down and dirty, and we talk about all the different kind of issues. That's the point where we will determine the transition element of the transition center. You want to begin to get people into a more normalized life, so that's the reason for the dorms. But I think it's in what I would call the intake area of that. There's some isolation cells, I guess, or they're not as hard as at the jail, but there'll be opportunity to determine with our task group people how much should we accommodate for that. And no matter where we are in Blount County, it's not going to be but just a few minutes till they can be back at the jail, which they're not going to want to do. So there's a little bit of a stick thing along with the carrot of transition, of rehabilitation and all that. But yeah, there'll be the ability for our correction staff at that facility to properly segregate, separate people as needed.
I got a question. I don't recall when I read through the packet, I know we're looking at option F, but as a strategic direction, how big of an area or how much land are we looking to purchase such, how much expansion are we going to allow? I mean, right now we're talking about a facility that's 288 beds, but what is the max we could expand to with this new property?
During the master planning process, the consultants developed for us some schematic drawings representing the program. The program is all these random spaces, this many square feet, and then you kind of put that together. They did a conceptual drawing for us that I can guarantee you is not what we're going to build, but it gave us a pictorial representation. The way that was laid out, we could probably get easily 1,000 beds on 10 acres. So we're looking at 15 plus acres all over the place.
I guess lesson learned with the current jail, we need to make sure that the parking ain't an issue or construction area. If we do want to expand this, it ain't an issue. So let's make sure our lessons we learned on the current jail, we reflect to this new purchase or when we're trying to find our site. So
We're definitely looking at that. And for those of y'all that may not know me or my background, I'm a retired civil engineer, land surveyor, land planner, builder. Designing site plans has been my bread and butter for 4 decades, and so I probably look at a lot more detail than anybody wants me to. But the site concept that we have sketched up and represented actually has a monstrous parking lot to accommodate the potential of a day reporting center, where you could have a whole lot more traffic than you might with mama coming to visit her son or something, and lots of green space. You know, we're definitely it's my background and experience happens to be in favor of this because I'm really particular in looking at that sort of thing.
I know that Blount County is not unique to overcrowding jails. I mean, you look across our state, every county seems to be struggling with the issue. When we looked at this, I know we looked at the potential growth in Blount County of these numbers. Did we look at per capita Blount County against other communities in the state to see if indeed our rate of incarceration is consistent or higher or lower? Are we doing a better job than most already? I'm just trying to figure out if we've analyzed that aspect.
There was a lot more data gathered than if we tried to catalog for y'all all the data, it would have been 500 or 600 pages. But yeah, that was looked at. Comparable local jurisdictions, statewide, nationwide. You can't imagine all the things that were looked at to develop this, the protocols for our bed needs projections.
Is it your recollection that Blount County was consistent with the rest of surrounding communities, or was their incarceration rate higher or lower? Do you have a recollection?
I don't recall any anomaly either way. It's pretty in this part of the country, particularly in the Appalachians and in this area. It's pretty high.
And just following on that same thought on the recidivism end, you know, what we're talking about, hopefully building as a community, is a whole continuum. You know, not just the jail. The jail is the centerpiece of our criminal justice system, along with the judicial system that decides where people have to reside. But the recidivism rate, did we analyze recidivism rate in our community versus other communities as well?
I don't think so. Potentially, one of the judges might be able speak to that a little bit relative to other places, but I don't think we, if I'm recalling right, we didn't have, we didn't have a system that let us do that.
And the only reason I'm asking is relative to what's our best practice? What are we aiming for? What's our target? And it doesn't mean we're even where we want to be, even if we're better than other communities, but at least kind of tells us where we benchmark when we begin this process. That's the basis of my question, really.
I'd say that's a very good topic of conversation.
Thank you. Any other questions for Mr. Sterling? Very good. Thank you so much. We appreciate your work. At this time, I would call upon Chief Deputy French to give us a current status of the Blount County Jail.
Thank you, Mr. Chairman. One of the things that I did when I was asked to do this, just to point out the projections that Mr. Sterling stated in the study on 536 for 18, our 2018 numbers of average daily population is actually going to be 564 or 565 for the 2018 time period. And looking at the last 6 months, our average population was actually 584. Our population average for women were 131 and males were 433. Currently today we have 569 inmates in the facility, which of that 91 of those are females. And just to give everybody, if you don't know, we only have 64 female beds. To break down the population by pods, we have a Charlie pod and a Delta pod. Our Charlie pod is at 200 inmates that has a total of 158 beds, and our Delta pod is at 309 inmates with 192 beds. So
I don't understand. What's the Delta pod and
that's just the name of the pod.
oh, okay.
Yeah.
Nothing attached to that.
No, ma'am. Well, and each pod is specific to the type of inmate classification. C pod, I'll call it C pod, has our minimum, our females, our workers, and things like that. Our D pod has more of the medium and maximum security male hardware. So that's what I have. If anybody has any questions, our jail administrator, Captain Gregory, is here too, if there's any questions that they might want to direct to him. He's our resident expert.
Questions folks are curious about? Just relative to the numbers that we have in front of us, would it be possible to get, not today because I'm sure you weren't prepared for this, but relative to the incarcerated population, do we have a felony versus misdemeanor classification that would be possible?
Yes, sir. I do. I'm going to give this number out. I want to back check it because we have changed systems. But I do have a number, but I would like to back check that and make sure that it's accurate. But for felons, for the last 6 months, we averaged 223. And for misdemeanants, it was 115 on an average daily population.
Can I add something to?
Certainly.
That doesn't include, right now we're averaging between 100 and 110 people in recovery court who otherwise should all be incarcerated, whether state prisoners or local. And then we have Veterans Court just started, but we have 7 already there. So if you take that number of 100 plus people, they should also be in the jail, but they are in alternative sentencing transition program, so to speak, in a treatment program. So you can see right there that number would be skewed if we didn't already have some programs in place.
And on top of that,
Let me add too. The recidivism rate in recovery court is very low compared to the folks that non-recovery court folks. It's what's your rate?
I don't want to say
if it's-
in case I get it wrong.
Anecdotally, I can tell you, they do, with what they have, they do a great job as opposed to what I don't have as far as I'll lock them up and they get out eventually and they come back. For instance, like yesterday, I had this little girl who she was in, I don't know, some kind of drug charge or something, or whatever, but there was an agreement made that she was going to get out and go into some kind of treatment program. Okay, well, this same little girl has OD'd at least, I know of, 4 times and has had to be brought back with Narcan 4 times or she'd be dead. She needs to be in a program like Judge Harrington has that we don't have. And I'll add this too, as far as misdemeanors, we've got right now 1,200 people probably on misdemeanor probation that maybe should be in jail, but we're taking a chance on them. And then once you take a chance on them, when they mess up, then what do you do with them? You give them another chance maybe, or you put them in jail maybe, I don't know.
Yeah. Who makes the decision as to whether or not it's going to be a felon charge or a misdemeanor? I'm trying to understand what degrees of freedom does the judiciary system have in defining these categories, nonviolence versus violence?
That's all done by statute.
Yes.
So what, so that's done by statute. So everything is classified a felony or a misdemeanor. And then there are some cases that there are negotiations for felonies to be reduced to misdemeanors. Most negotiations are done by, all of them are done by the district attorney's office. We have no discretion as far as a case being reduced from a felony to a misdemeanor. We have no discretion whatsoever. Pled before us. Say that a felony is reduced to a misdemeanor, it's reduced to a Class A misdemeanor, there are parameters on what the sentence has to be. And there's certain mandatory minimums.
So if we could have more degrees of freedom by the judiciary system, maybe we could also begin to attack the problem with beds.
Then you're
I know.
usurping the fundamental, there's some issues there. Right.
You do raise a good point, though, about any recommendations that we want to make along this process would be very important to have the district attorney's office to weigh in on those suggestions as well.
And the district attorney's office sometimes doesn't have the discretion that people think that they have. So the legal system is complicated. It is. And
But I was just wondering, as we proceed down an avenue to try and address the situation, is what kind of working relationship should we have or do we have with the judiciary system to help move us in the direction that we want to move towards, which is rehabilitation and less incarceration? Oh.
court as an example. So I had talked about the 100 to 110 people that we have in recovery court. The district attorney's office is the first line. They have to agree for them to be assessed and to be brought into recovery court. So right there would be no recovery court without the district attorney's blessing. So they have signed off and negotiated for every single person in that program to be there. And so that in and of itself, I think, shows their commitment to rehabilitation.
Okay. So you in essence liaison back to the district attorney's office. The judge is here.
I don't know that we're per se the liaison back to them. We're here to offer our insight and guidance and certainly talk with them, but,
I can say this.
we get along.
Yes,
We
okay.
get along. We all recognize there's a problem.
Yes.
Everybody recognizes the problem.
That's
We're
the
not
issue.
build our way out of it.
Just so y'all know, the task groups that I've spoken of, these two judges were on the task groups, were very, very good at attending, only missed if something desperate was going on. The DA was on the task group. The Public Defender's Office was represented on the task group. Chief French was on task group. We had a very broad cross-section of people, and we never left a workshop session, 3-4 hour workshop session, disagreeing. Really, really worked well together.
One question before we leave, and then we'll move to the next agenda item. Relative to the transition center and its construction, would it be obligated to meet the same codes and criteria that the jail would be?
As far as normal and routine building codes, there's no variation. I'm not completely clear, and it'll be one of the first things that we attack, is whether the TCI standards that apply to a jail have any flexibility with regard to a transition center. Transition center is not something, they haven't been around as long as jails, and there aren't as many of them as jails, so that's something we'll have to determine. And again, our task groups in consort with our consultants will get us on the right course.
CI does have categories of housing, dormitory, isolation, secure, so there will be some, since this will be similar to a dormitory style, there will be some TCI requirements to make sure that the square footage is certain square footage per inmate, toilets, sinks, so on and so forth. So.
And the source of my question really is about cost. Is there a cost benefit in building something that doesn't have to meet the requirements of a jail, because those are very expensive to build? It's not really a question, it's just a statement. You know, that's the origin of
it
my
absolutely
question.
would be less expensive to build per square foot.
Move to the third agenda item. I think our time is quickly passing here. Our committee goals discussion. Thought after hearing this review of the study that's been done by the prior committee and this committee being constituted, it would be of value to make sure we all know what goals we're setting for ourselves and what we are trying to achieve. So it would be great if we could have an open dialogue for a few minutes about the things we'd like to see this committee accomplish. And I would remind you, because of the fellow in the back, if you bring your microphone close when you participate in discussion, he'll catch all of that on that. But I'll start with piggybacking off what the judges have already commented about, which is we have some models already in this community that are being effective for targeted populations, and so I would put on the table that there are probably other targeted populations that we could look at, models that could avoid incarceration on the front end in concert with the judicial system and the DAs and we might want to explore those as well. The process that we're talking about and trying to make recommendations about is a continuum, and the continuum will always include people on the front end who hopefully never get into the jail, the people who get in the jail who need to be in jail and are addressed, and then there are people who need to leave the jail quicker than other people. And it'd be great if we could kind of think about that whole continuum in this discussion. So I'd open that up for comments.
I've got a comment. It's a little bit off topic, but one thing I want to point out, I don't think a lot of people in Blount County recognize how big and how good the recovery court is. I've been involved with it somewhat for just 6 months, and I'm amazed at what they're doing. So that is a good example, in my opinion, of kind of this transitional facility or what can be done with alternative programs. So I just wanted to go on record that people need to investigate or look into the recovery court because they're doing a lot of good things.
I don't know this group real well, but I'm a therapist by training. I'm really comfortable with silence, so I can wait a really long time. Or we can offer a few goals that we want to accomplish.
You know, I can tell you just in general some of my thoughts as I thought about being a part of this committee is I think someone in the audience here said, you know, I don't believe we can build enough jails. We can't afford it. Okay, so, you know, there needs to be an education, I think, of the county in general about it's too expensive to try and house everyone. So I believe we do need to have some process that allows us to accommodate the different kinds of you know, violent versus nonviolence. I think we really do need to focus on that. And I think any committee that's in place to address the overcrowding should focus as much as possible on how can we prevent or what do we need to do in order to rehabilitate people, give them the necessary treatment that they need to make them a, you know, viable member of society. So I think the discussion and the activities that are going on are very positive. I've heard some good things about the drug court. I have not had an opportunity to come over and actually, you know, interact with the system. But, you know, the more effort we put up front, we're trying to come up with something that does take into account things that happen in our lives, but to focus more on preventing people from getting into the system. Because once you get in, it's hard to get out. So.
I can, and I would say just from, and Judge Burr and I can speak to, because we're in the trenches working with the offenders on a daily basis. I think that the benefits that I see in a transition facility, especially if we're getting the proper assessments, if we're identifying the individuals that can be rehabilitated, I think that we need to recognize and understand, though, it's a tremendous amount of work. It is a lot of work. It takes a lot of commitment. Not just from the people working within the system, but with partnerships within the community. We want to see people employed. We want to see people taking care of their families. We want to see people mentally stable. We want to see them drug-free. We want to see them paying their taxes and participating in their community. That's the goal. And so, but that takes a tremendous amount of work, because you might have individuals that have been in the system for 20 years or even 5 years. And so you have to teach, rehabilitate, reintroduce, and that's a process. It's not an overnight process. It takes a lot of time and it takes a lot of commitment, but it is completely possible and doable with all the right tools in place. So I think that we all have the same goal of trying to identify. We're always going to have a brick and mortar jail. Always. There's always going to be those offenders that are violent or that are need to be incarcerated. But I think the transition facility, from what I hear, serves a lot of purpose because just like Judge Brewer was talking about the young lady in his court yesterday, he can release her and tell her to go to treatment, but without some type of stabilization, without some type of period of time, she's not going to go. Or if she goes, she might not make it. There's just a lot. It takes a tremendous amount of work and effort and supervision on the front end. And what we found in recovery court is you really need to be involved for a long period of time to achieve that long-term change. So I reiterate what you're saying. I think that we do need to be committed to rehabilitation, and we're always going to have a jail. But that's why I think the transition facility seems to make so much more sense for the goals of our community.
I'm going to summarize what I think I've heard so far, and we can put these into goal statements for the next meeting. But I think it's a really good start for us on the front end. So I think, as the judge just said, it'd be great for us to have a community that had a criminal justice system that was effective and addressed the needs of safety first in our community. I think if the DA was here, the DA would say that their office is charged with community safety first and foremost. So that needs to be a priority, that we need to have a well-functioning jail when people need that. We need to have a place for people to get services and assistance so that they can be productive members of society. That's first and foremost. And we fundamentally seem to share a belief that with the right assistance and support over time that people can reform and they can participate in the community in a helpful way, and they could get better, frankly. And then we intend to do that by looking at all aspects of that criminal justice system before we make final recommendations. So I think that's a pretty good summary of what our dialogue has been. And relative to next steps, we have some site visits that we have organized. I think the first one is on the 23rd of this month in Rutherford County. And so I hope that as many as possible can participate in that tour. And then I think we have yet to schedule or are still working on scheduling a trip to Davidson County as well. The 6th of February, thank you. So we have those as next steps to look at what we believe to be some best practices in our own state. And then, we will continue to collect some data. I think data is really important and relative to making good decisions. So let's act on facts instead of on assumptions. And then the third item, it would be great if, as we as committee members are out and away from here, if we come across best practice models, might bring those and share those with other committee members that we could look at those as well. I'm familiar with a number of other states who have had great success, but to the judge's comment, it takes a community investment. It is not just government doing it, it is private entities, it is community members, it's volunteers, and then the results are pretty powerful from what we've seen in other communities, like Texas has a number of initiatives as examples. Any other things that this committee believes we ought to be doing as next steps in addition to those?
But I think one of the most powerful things that this committee could do, and I'm sure Judge Harrington would be pleased for us to welcome them, is to have a participant who has succeeded in the drug court program, or recovery court, excuse me, Your Honor. Keep calling them drug court, Old Heart. Come and just give us their story and understand, if you talk to the folks, of what it takes for them to get out of that cycle, as the commissioner stated. Once you get in, it's hard to get out. And it's amazing how the little things that if you talk to those folks, keep them in that cycle, and it might just be not having a driver's license or not having a way to be transported to a job, and that gets them back, keeps getting them in that cycle, because then we pull them over, they don't have a license, and then we bring them back to jail. And they're on probation, and they get their probation violated. So I think one of the next steps, if it would be acceptable, is, and then the judge would be able to do that, is to have a participant tell us a success story and what some of those steps are that we need to take and recommend to the commission to get those people in place, to help them get those needed resources. Or maybe there's a community organization that provides it now that won't cost the county any money.
Just to add on to that, would it be jail setting issues? Jail, so what are the mitigate that? To hear incarceration, what are the
It's for a fact, but I suspect it would have to be someone who's recently left the jail, maybe, as opposed to somebody in the jail. Yeah.
And I think source in our jail inspection committee, and Ms. Hannum is there on a daily basis a lot of times, and knows those issues that inmates face, and just our physical plant and the needs that we have, people sleeping on the floor. And that would be another step that I would encourage each of you to come and schedule a visit to the jail and see what the current facility looks like. That would be a next step that I would encourage everybody to try to do.
I would also encourage you to visit the Recovery Court office. You have to sign confidentiality waivers, but to also attend a session. And you get a good feel from the interaction of the challenges, because the participants, some of them are in the stabilization phase, are in the jail. They're brought up for the session, and then we have individuals who have just recently been released from jail, and then you have some that have been out for a year, and that's a good hour, 2 hours spent getting a good feel for jail, recently out, and then long term.
me?
Just in summary, for our next steps, we've got a couple site visits in the state of Tennessee. We'll continue to collect some data. We'll look at best practices. We will, at the judge's willingness, have either a participant or visit one of her court sessions for Recovery Court. Possibly as many of us as possible tour a jail and see what that is.
You're welcome to come and watch court one day.
That's also
It's good.
Come watch that. Just see what goes on every day in court. And I can help you find a good example.
Very good. I would extend to you, I appreciate your participation tonight. This is a great start to what we hope will be a meaningful contribution to our community. I would entertain at this time any motion for adjournment. Thank you, Deputy Chief. Is there a second?
Second.
Thank you, Tom. All in favor?
Aye.
Have a great evening. Thank you.